So we will be discussing more about red flags today and red flag screening. So one of the major purposes of red flag screening is to reduce the risk of missing any serious pathology. Furthermore, some of the other reasons include making necessary referrals, making differential diagnosis, and also identifying other serious illnesses. And today we will be bringing our focus primarily on discussing more about the lower back pain and red flags. So when it comes to the diagnosis of lower back pain, the diagnostic triage is often utilized. And there are three categories. The first category is spinal pathology, which accounts for less than 1% of the cases in primary care. Second category is also known as radicular syndrome, which accounts for 5 to 10% of the cases in primary care. And lastly, the non-specific lower back pain population that actually accounts for a total of 90 to 95% of the cases in primary care. Now, what we have here is a further breakdown from the previous slide, and some of the examples of spinal pathologies actually include vertebral fracture, axial spondyloarthritis, spinal infection, and also caudal equina syndrome. Next, for the radicular symptoms, it includes radicular pain, radiculopathy, in addition to spinal stenosis. And if they are excluded from the first two criteria, then they will fit into the non-specific lower back pain group. And in your history taking, here are some examples of your lower back pain red flags. This includes age, unexplained weight loss, and within the 24-hour history, if there is actually pain that is unsettled, and if there's history of cancer, fracture, and osteoporosis. Also, incontinence, numbness, burning or needling sensation, and also saddle anesthesia. And adding onto the list, we also have the past trauma history, and also the past medical history, fever with chills, and also severe sensory and motor deficits. So it is very important when in doubt to refer out. So in the history taking process, if you do find some red flags that are identified, you want to refer them out to a primary care physician for some further assessment. This will then reduce the risk of any further complications from anything missed, and the patient's safety would increase as a result of that, and therefore you will have a happy patient. And this may lead to better patient care and also patient satisfaction. If you haven't done so, please be sure to check out our other videos in the education discussion series. Again, thank you very much for all of your time. Be sure to like and subscribe for more.